In this video, we will review the bones of the knee. We will begin with a look at the distal aspect of the femur, and then move on to explore the proximal ends of the tibia and fibula, and finally conclude with a look at the patella. The distal end of the femur articulates anteriorly with the patella at the patellofemoral joint and inferiorly with the tibia at the tibiofemoral joint. By removing these bones, we can get a better view of the femur itself. Here we are looking at an anterior view of the left distal femur. Its most striking features are the large rounded medial condyle and lateral condyle. The surfaces here and here are covered in smooth articular cartilage and form part of the tibiofemoral joint. On the medial aspect of the medial condyle, the high point here is known as the medial epicondyle, while a corresponding high point on the lateral side is known as the lateral epicondyle. Superior to the medial epicondyle, another raised roughened area here is known as the adductor tubercle and serves as an important site for muscle attachment. Where the medial condyle and lateral condyles meet, this depressed region is known as the patellar surface and serves as part of the patellofemoral joint. Switching to a posterior view, we can observe that the medial and lateral condyles are separated by a space known as the intercondylar notch. We can also observe the flat area here, known as the popliteal surface, and these two ridges of bone here and here, known as the medial supracondylar line and the lateral supracondylar line. Next, we'll rotate the model to observe how the condyles of the femur are quite convex, both in a medial lateral direction and in an anterior posterior direction. Next, we'll look at the features of the proximal tibia. The distal femur and the fibula have been left in place for reference. The superior portion of the proximal tibia consists of the large medial condyle and lateral condyle. Their superior surfaces are relatively flat and known as the tibial plateau. On the anterior aspect of the proximal tibia is the large tibial tuberosity, which serves as an attachment site for the patellar tendon. On the lateral aspect is a facet or smooth flat surface that meets with the fibula to form the proximal tibiofibular joint. Here is a better view of the medial and lateral tibial plateaus. The raised area between them is known as the intercondylar eminence. In this view, we're looking at a partially flexed right knee with many of the soft tissue structures left intact. Here is the lateral condyle of the femur, here is the fibula, and here is the tibia. We noted earlier that the condyle of the femur is quite convex, while the tibial plateau is relatively flat. The tibial plateau is made functionally more concave by the presence of a fibrocartilage structure known as a meniscus, which is thicker towards its outer edges and thinner towards its central portion. We can also peer within the joint to see the intercondylar eminence, an important site for ligament and meniscus attachment. Returning to our skeletal model, we'll conclude with a look at the fibula and the patella. The enlarged proximal portion of the fibula is known as the fibular head. The tapered area below it is known as its neck, and this leads to the shaft of the fibula. The patella is a roughly triangular bone found embedded within the tendon of the quadricep muscles. Its flat superior surface is known as the base, while its pointed inferior surface is known as its apex. Switching to a muscle model, the base of the patella would be here, and its apex would be approximately here. We can see 3 of the 4 heads of the quadriceps as they attach into the base via the quadriceps tendon. And we can see the patellar tendon, sometimes referred to as patellar ligament, which attaches from the apex of the patella to the tibial tuberosity. Finally, we'll take a look at the posterior aspect of the patella to observe the smooth, flat surfaces known as facets.